Hello and Assalamu alaikum. Ultrascan Diagnostics. This is the CBCT of the patient that you had requested. The 3D rendering shows that the upper left central incisor is impacted. The upper right central incisor is erupted. The upper right lateral incisor is erupted. The upper right canine is unerupted. The upper right first premolar is unerupted. The upper right second premolar is unerupted. And the upper right first molar is erupted as well. The lower arch, we can see all the incisors have erupted. Now, taking you to the panoramic view, on the panoramic view, it is clearly visible that the central incisor is impacted and is placed horizontally with the crown towards the buccal cortical plate quite apically. Moving to the transaxial view, this is the transaxial view. This here you can see that the central incisor is not even horizontally, it is placed quite in an opposite direction. The apex is just below the floor of the nose and is just penetrating the cortical plate very apically. The root of the tooth is, if we can slightly just change angulation for the doctor, the root of the tooth is placed quite palatally. The lateral incisor, however, is now moving into the position. This is the lateral incisor is now moving into the position of the central incisor, which is clearly visible here. The canine is right behind the lateral incisor. Now I'm going to take you along the long axis. This is the long axis. So along the long axis, you can see this is the lateral incisor which has erupted on the upper left side. The canine is following suit very slowly. If we move mesially, we can see that the canine is in contact with the roots of the lateral incisor, whereas this is the root of the upper left central incisor. Now moving to the distal aspect, on the distal aspect we can see that this is the first premolar right here, and behind the first premolar we can actually see the second premolar developing as well. On an axial view, now this is the axial view and this can identify a lot of the problems that this patient is facing. This is the right hand side where my mouse is. This small r will denote the right hand side. This L will denote the left hand side of the patient. Now if we move apically, I'm going to identify and zoom in on each tooth. So this is the upper right central incisor, the upper right lateral incisor, the upper left central incisor is missing. This is the upper left lateral incisor. Moving further apically, here we can see this is the appearance of the upper left central incisors. The roots are placed quite apically, quite palatally. There is a radiolucent area. It could be a cystic lesion, it is unilocular, or it could just be an eruption related radiolucency. But we are moving apically and we can see that the tooth, this is the enamel, this is the central and the lateral incisor, this is the canine of the upper left side, and this is the canine of the upper right hand side. And here we can see just where the nose and the premaxilla ends and the nose starts. This is where the root of the tip or the incisal edge of the upper left central incisor is placed. Now we will take you to the 3D rendering once again. So here if we zoom in, this is where the apex of the root basically of the central incisor on the upper left hand side is visible. So if you have any further queries related to this case, please feel free to reach to our team and we will be quite happy to help. Thank you very much.